Hi guys, this is Juliet Cha, and this is my presentation on seeking adherence on the flaws in the healthcare system. Now, the question is, why am I talking about this topic? And the reason why I'm talking about this issue is because it's a highly relatable issue that applies to a bunch of people. You use the healthcare system for giving birth, getting vaccinations, getting surgery, getting medicine, and etc. The list goes on and on. And these are just things that happen in normal life. Vital to understand that without proper knowledge, the system that we have now will just continue to take advantage of us, and we as the consumers will keep having to pay these exorbitant prices in exchange for minimal knowledge, belittled pain, and even ignorance to our health concerns. As I said in previous presentations, a point that I keep reiterating due to its significance is that when looking at the US healthcare system, we can see less emphasis on primary care, which means that we as patients are getting less preventative measures so that we don't get the illness in the first place. We're also seeing more emphasis on practice revenue and high patient turnover, meaning that patients are getting turned out the door faster because seeing more patients means more money for the hospital. For us, that means less time for asking the questions that we need to, less time getting to know about our conditions or even the procedures that we're going to go through. Um, and statistically, US citizens spend more on healthcare than any other country, yet we still have one of the worst health outcomes. It's a backward system. Healthcare is supposed to be about helping people with their health, but at this point in time, our money seems to be more important. I'm at the point that I no longer believe that the problem we're facing is a question of whether the US healthcare system is broken, but I believe for a fact that the US medical system is no longer focusing on catering to the needs of the general public. I think one of the main problems is that um, the system that we have, we don't think that it's ever going to happen to us, these huge problems, until we're actually in the thick of the situation. A couple of weeks ago, I was actually talking to a friend who's currently pregnant, and she was telling me about all of the different things that she would have to pay for when giving birth at the hospital. One of the points that I remember that surprised me was that she had to pay approximately $39 to do skin to skin contact with her own baby. And this is all included in the huge and convoluted bill that she's going to get for her whole stay at the hospital. And it's not just her either. I have personal stories too, where my family had to pay for unforeseen medical expenses, and for each itemized bill that we got, there was a point where we were like, why have we been charged for that? In one of my public health classes, there was a story about a woman who had a heart condition at the age of 35, where she had had about 7 different heart surgeries and a huge stack of medical bills. Eventually, she was told that if she had any more surgeries, there was a huge potential that she was just going to die on the table. This woman actually decided to go out of the country to a different hospital and get a diagnosis from them. Um, and what that hospital told her was that the reason why she was having these problems in the first place was because of her lifestyle choices, which were bad. For one, this lady was overweight and she didn't exercise much. So the doctors at this hospital focused on helping her shed some of the weight and eat healthier foods and get more exercise. And she actually ended up not even needing any of her other surgeries. If the doctors in the US had focused more on primary care and looking into why this woman was having heart attacks in the first place, she wouldn't have needed so many surgeries, nor would she have had to pay so many medical bills. What I'm trying to say is that what if this was you or another family member? I think that you would have preferred the hospital that focused on the primary care rather than the hospital that just jumped into the highly expensive surgeries. We need to improve the US healthcare system so that there's more emphasis on primary care, so that we don't need to come in for surgeries, and so that we will have a better health outcome overall, statistically. Another problem is that we as patients don't get enough chances or time to talk about our problems with our doctors. For one, when the consultations run longer and more questions are asked, the more expensive it gets for the patients. But the reason why people keep coming back and having to ask these questions again and again is because the hospital isn't giving us the information to us and it's not available to us to understand why something is happening to our bodies. Additionally, patients have very little information on the outcomes of their illness that would be very important, like how long are they going to be out of the hospital to recuperate from this illness, or out of their jobs to recuperate from this illness. How is their pain going to be controlled? How likely are they going to get infections from their procedures? The healthcare system needs more transparency so that we can get the answers to the questions that we're asking right now instead of later when we come in more and more to the hospital. Another one of the problems that I think is happening in the healthcare system is that we don't think enough about the FDA and the design of the FDA. It was designed with a major flaw, which is that it was mandated not to cure the illnesses, but only to make sure that the medicine will do no harm, which is, of course, important. But this means that the drug approval costs are going to skyrocket to the billions. And if we manage to change the mandate to include both safety and healing, more drugs will be improved, approved, and more effective for us. Basically, what I'm trying to say is that if we implement any or all of these changes, then there's a large chance that our spending on healthcare will fall to match other countries' spending. And I really don't think that that's a terribly unreasonable demand to try to achieve. Thank you for listening.